3. Well, having a son or daughter who is an athlete, it's a dream for some parents, right? But high intensity training and body image expectations can be a lot of pressure for some teenagers, which can lead them down an unhealthy path. Joining us this morning is the Chief of Psychology at Sutter, Dr. Jennifer Thomas. Thank you so much for being here.
Yes, thank you for having me.
This is a tough topic, but it's so important. So let's just begin with the basics. What exactly is anorexia athletica, if you had to describe it?
So they also call it hypergymnasia, and it's actually not a defined DSM term, which is our Diagnostic and Statistical Manual, but it is something that we're starting to realize is a very significant issue, and it relates to anorexia and eating disorders overall. And what we find is a lot of athletes have been, from a very early age, working out at such high levels that they become attached to that working out. And if they're not able to do it, they actually may feel depressed. They may be concerned that they're getting overweight. They might be counting their calories. And this can cause significant difficulty in life overall.
Well, to your point, I wanted to mention that essentially it's the pressure that they're feeling, right? This intense pressure to perform. And so if you're a parent, you're listening to this interview and you're saying to yourself, what kind of symptoms am I looking for? You touched on one of them, restricting calories perhaps, but what else do you typically see?
So I think I'm just going to share a little bit of personal information. I was a gymnast growing up. And I was practicing from the ages of 7 until I was 20 years old. And there was so much pressure on staying thin, on staying athletic, that there was even a point where I had to have, the doctors had to look at why I wasn't growing. So we can see symptoms where growth is delayed, where there's metabolic symptoms that are happening, and then you can also see the emotional side effects that are occurring, where it's like, I'm not working out or I'm not doing what I'm supposed to be doing with my athletics. And so now I'm really struggling.
Okay, there's that mental component to it, the emotional mental
absolutely.
component. So as a parent, in terms of supporting your child in this regard, you know, you want your child to succeed athletically if that's the path they so choose, but how do you set goals but not cross a line here?
I think that's really important, and I think that's kind of where it gets hard. But as a parent, I would say, you know, if your child is working out 4 hours a day doing a sport, after that, you want to know that they're having social activities, that they're engaging with friends, that they're engaging with family. Because when you get into high-level athletics, it is like 4 to 5 hours a day. And so there shouldn't be crossing over of I need to now do more and more and more. We have to look at kind of our time, how valuable it is, and then what are the relationships like outside of that? Is my child having those relationships, or is my child solely focused on, or my adolescent solely focused on these behaviors and working out and being the best, that they're not even enjoying in other activities of daily living?
All right, Dr. Jennifer Thomas, Chief of Psychology with Sutter Center for Psychiatry. We appreciate your time so much this morning.
Thank you.
All right, Martina, let's send it back over to you for a check on our traffic.
Good morning. Here is a look downtown off of Cap City.